Hello everyone. In this video we will discuss about the drug charging policy and dispensing of controlled drugs in the subject pharmacy practice. In previous lecture regarding this subject we discussed about the dispensing of drug to inpatient and dispensing of drug to outpatient, that means dispensing of drug to ambulatory patient. Now over here in this chapter, now one more point is there, that is regarding the drug charging policy. Now in India, what happened generally? There is an employee state health insurance scheme that is known as the ESIS, and also there is a central government health scheme which provide the healthcare need to the government और इंडस्ट्री एम्प्लॉय, मतलब ये स्पेशली एम्प्लॉय के लिए एक इंश्योरेंस स्कीम है दैट इज प्रोवाइडेड बाय द गवर्नमेंट एंड दैट रन बाय द सेंट्रल गवर्नमेंट, वन ऑफ द स्कीम, एंड जनरली फॉर द एम्प्लॉय इन मुंबई, कलकत्ता, दिल्ली एंड अहमदाबाद. देखिए जनरली दिस इज वन ऑफ द स्कीम एंड दे आर गिविंग द इंश्योरेंस, in both this scheme they are based on the receiving nominal payment from the employee. देखिए यहाँ पे जो भी कोई कंपनी है, इंडस्ट्रीज है, तो they will receive the nominal payment for this and then afterwards they are in against that payment they are providing such a insurance. तो यहाँ पे इंडिया में जनरली एक कंडीशन अगर हम देखें तो यहाँ पे क्या है कि बिग इंडस्ट्रीज है, they will follow some modified plan also and they will give the burden or whatever the expenditure of the healthcare that is on the employee only, and whatever the expenditure they are doing that will be paid by the employee only, but the charge some drugs we can say that will be free and some drug that will be subsidized. तो यहाँ पे एक इजी सिस्टम है कि इसके कारण एम्प्लॉई को डायरेक्टली बेनिफिट होगा. ESIC स्कीम के अंतर्गत जो भी हॉस्पिटल्स है तो वहां पे जाके डायरेक्टली कोई एम्प्लॉई है तो वो डायरेक्टली ही कैन कंसल्ट ओवर देयर एंड द ड्रग्स दैट इज आल्सो फ्री. सो दिस इज वन ऑफ द ड्रग चार्जिंग पॉलिसी. देन प्राइसिंग ऑफ ड्रग्स, इफ यू आर कंसिडरिंग अबाउट द प्राइसिंग, देन द रिटेल प्राइस ऑफ द ड्रग, we are considering about the retail price of the drug marketed in India, that is fixed by the central government by issuing one of the drug price control order, that is also known as the DPCO under the Essential Commodities Act. See, this DPCO, Drug and Price Control Order, DPCO Act, they are controlling the drugs, controlling the price of the drugs that is in a retail market. So this is one of the aspect. I want to show you some website related to this. See, this is for a NPPA, National Pharmaceutical Pricing Authority, Department of Pharmaceuticals, that comes under the Ministry of Chemical and Fertilizer under the Government of India. See, D.V. Sadananda, he is a Honorable Minister of Chemical and Fertilizer, and Sri Mansukh Mandavia, he is a Honorable Minister of State of the Ministry of Shipping and Ministry of State in the Ministry of Chemical and Fertilizer. That means they are from this website they are giving or they are regulating the price in India, and there is one of the information यहाँ पे information रहेगी regarding the DPCO, Drug and Price Control. Then one more thing I want to show you, that is regarding the new things in this website. See, this one. See, one of the regulation, one of the circular they have published regarding the NPPA has fixed retail price of 7 formulation under the Drug and Price Control Order 2013 relating to 76th authority meeting dated on 22 June 2020. देखिए ये क्या रहता है, एक सर्कुलर हम देखते हैं तो आपको पता चलेगा कि NPPA what they are doing. See, this NPPA they have given one order to the companies that, for example, here one of the drug name that is mentioned nebivolol and telmisartan tablet. Now this one is the uncoated bilayer tablets, the strength that is the nebivolol hydrochloride, that is 5 mg, and tell me certain, that is 40 mg. Now unit, one of the unit, smallest unit, that is 1 tablet, and that is manufactured by the Lupin Limited. Now the NPPA, they have fixed under the DPCO, they have fixed the price of this particular drug, the retail price or maximum retail price, we can say, that is 12.59. So such type of order they are giving. So we can say in India, one of the method is like this only. Directly the price that will be controlled by the under the DPCO or NPPA, they will control the drug and which are essential. So generally they are maintaining the price of essential product. Now one more thing, one more website is there, that is regarding the Gujarat. We will see over here. See, these are the essential drug list. In case of primary healthcare center, PHC, then secondary healthcare, CHC, and TB hospital. These are the important essential medication that is fixed or that is mentioned over here. And tertiary healthcare, that is district or sub-district and medical colleges. So these are the essential product that remain, the stock of such a product that remain with the hospital. One of the list that has been published of essential drug, that is for the 2020-21. These are the essential list, essential drug list. See, I just want to show. देखिए यहाँ पे आपको पता चलेगा कि यहाँ पे क्या क्या कौन कौन सी essential drug है, या फिर if you want to check any product whether it is essential or not, so directly देखिए ये स्पेशली गुजरात के लिए है, तो गुजरात के लिए जो भी essential product यहाँ पे मेंशन की है, तो that will be available with this website. तो ये वेबसाइट जो भी है गुजरात मेडिकल सर्विस कॉर्पोरेशन लिमिटेड, इसके ऊपर से आपको इनकी इंफॉर्मेशन मिल सकती है. सो the basic thing is that how the price of the product that is controlled. Now we will see. Generally the supplier of the drug, both in private and retail drug store as well as the hospital, undertake pricing survey and publish the data that is obtained. So generally supplier क्या करते हैं कि वो एक survey produce करते हैं, या फिर on the basis of survey they are publishing such a data, and on the basis of that they are deciding one of the particular charge, और मतलब क्या चार्ज लेना है एक प्रोडक्ट का, तो वो इस एक सर्वे करके उसके ऊपर से वो फिक्स कर सकते हैं. देन ईच हॉस्पिटल कैन डेवलप इट्स ओवन शेड्यूल ऑफ प्रिस्क्रिप्शन प्राइसेस. हर एक हॉस्पिटल अपनी अपनी तरीके से भी वो प्रिस्क्रिप्शन प्राइस क्या लेना है और ड्रग चार्जेस की ड्रग क्या चार्ज करना है, प्राइस क्या रखना है. सो दैट कैन बी डिसाइडेड बाय द हॉस्पिटल ऑल्सो, एंड दे कैन डू द सर्वे ऑल्सो. At present, many hospital pharmacies establish prescription price on the basis of percentage markup over cost. देखिए एक सिस्टम है percentage markup over cost. The percentage selected is usually that is of neighboring hospital. देखिए आजू बाजू में जो हॉस्पिटल है तो neighboring hospital, how they are taking or how they are doing the profit. So only on the basis of that thing, one of the percentage markup over cost will be that, and on the basis of that the particular hospital they will decide कि उनको क्या चार्ज रखना चाहिए particularly for the drug and also for the prescription. In some hospital with low, देखिए यहाँ पे बहुत बार क्या होता है कि कोई ट्रस्ट का हॉस्पिटल है तो वहाँ पे चार्जेस आपने देखा होगा कि कम होगा. कोई प्राइवेट हॉस्पिटल में आप जाते हैं तो वहाँ पे इनिशियली चार्ज है that will be nearly 200-300 rupees. And in case of any trust run, any hospital that run by the trust, then there will be only 20 rupees, 40 rupees, like will be in a hospital. In some hospital with low direct and indirect cost, percentage markup figure may be high enough to permit a profitable operation. मतलब इस तरीके से हमें सिलेक्ट करना चाहिए जो भी परसेंटेज मार्कअप ओवर कॉस्ट है. एट द टाइम ऑफ सिलेक्शन, whatever the result it comes, that means after all, अगर हम टोटल एक साल के लिए अगर कंसीडर कर रहे हैं तो whatever the operation we are doing, that means the total cost will be set up accordingly that we should have some profit from by running this or by taking such type of charge. मतलब प्रॉफिटेबल ऑपरेशन आफ्टर ऑल होना चाहिए. सी स्पेशली ये कंसीडरेबल है इन केस ऑफ प्राइवेट हॉस्पिटल. गवर्नमेंट हॉस्पिटल में या फिर ट्रस्ट रन हॉस्पिटल है तो वहाँ पे ऐसा प्रॉफिटेबल ऑपरेशन का ऑप्शन नहीं है, या फिर वो प्रॉफिट के लिए रन नहीं की जाती, तो वहाँ पे इसके ड्रग चार्जेस के लिए कोई बैरियर नहीं है. Then the cost volume profit. Cost volume profit, that is defined as the level at which there is neither profit nor loss. Cost volume profit मतलब ये डिजिट है जहाँ पे कोई प्रॉफिट भी नहीं हो रहा और लॉस भी नहीं हो रहा. On the basis cost of prescription is as follows. On this basis मतलब cost volume profit अगर हमें कंसीडर करना है तो what we need to consider prescription price. Prescription price how we will fix on the basis of cost of drug ingredient, मतलब जो भी ड्रग इंग्रेडिएंट हमें लग रहे हैं या फिर जो भी ड्रग हम दे रहे हैं तो कॉस्ट ऑफ ड्रग इंग्रेडिएंट प्लस वी नीड टू कंसीडर अबाउट द प्रोफेशनल फीस. और प्रोफेशनल फीस इफ यू वांट टू डिसाइड देन वी कैन राइट द कॉस्ट ऑफ डिस्पेंसिंग. डिस्पेंसिंग के लिए हमें क्या कॉस्ट लग रहा है प्लस वी नीड टू इंक्लूड द प्रॉफिट. एंड देन कॉस्ट ऑफ डिस्पेंसिंग दैट इज इक्वल्स टू टोटल ऑपरेटिंग एक्सपेंसेस ऑफ ड्रग, मतलब टोटल ऑपरेटिंग एक्सपेंसेस ऑफ ड्रग क्या है या फिर ड्रग कॉस्ट क्या है, एंड डिवाइडेड बाय दैट शुड बी डिवाइडेड बाय नंबर ऑफ प्रिस्क्रिप्शन फाइल, मतलब कितना प्रिस्क्रिप्शन एक दिन में कितने लोग हॉस्पिटल में विजिट कर रहे हैं या फिर कितने प्रिस्क्रिप्शन फाइल हो रहे हैं, उसके बेसिस के ऊपर से वी कैन डिसाइड द कॉस्ट ऑफ डिस्पेंसिंग. एंड ऑल्सो वी कैन डिसाइड द प्रोफेशनल फीस दैट इज इक्वल्स टू डिजायर्ड प्रॉफिट. हमें क्या प्रॉफिट चाहिए, 10%, 15%, like that we can decide. Then prescription lab expense कितना है, and that the value that will be divided by your number of prescription file. So these are the some basic thing that is considered in India. देखिए इंडिया में generally एक DPCO है that will decide the charge of the drug on for the essential product, and remaining thing or private run hospital they can decide by their own that what charge should be cost. देखिए जनरली क्या रहता है कि कोई हॉस्पिटल है तो दो हॉस्पिटल बाजू बाजू में है तो जनरली क्या होगा कि एक हॉस्पिटल है, नया हॉस्पिटल अगर खुल रहा है तो ही विल सी व्हाट इज द चार्ज द नियर बाय हॉस्पिटल दे आर टेकिंग, बिकॉज अगर मार्जिन बहुत ज्यादा होगा, अगर प्रॉफिट कोई हॉस्पिटल को ज्यादा करना है लेकिन मार्जिन ज्यादा रहेगा तो क्या होगा कि कोई पर्टिकुलर पर्सन है he will not prefer any expensive hospital. So in such a condition the hospitals what they are doing, they will take the survey of nearby hospital and accordingly they are taking the prescription price as well as they are taking or they are deciding the professional fees. So this is about the drug charging and charging policies of in case of India. Now we will discuss dispensing of controlled drug. Dispensing of controlled drug, this is one another point in this drug distribution. Now controlled drug, first we need to consider about the controlled drugs. A controlled substance is generally a drug or a chemical whose manufacture, possession or use is regulated by government, such as illicitly used drugs or prescription medication that are designated by law. That means such a product which are known as a illicitly used drug or abuse, that is the drug that is used for abuse or the drug that is used for addiction, such a drugs that is known as a controlled substance. And in this condition or the controlled substance, the manufacturing of such a substance and possession or the use that is regulated by government. That means government will decide how the use should be or the who can write the prescription or how the storage of such a drug should be maintained. So this will be regulated by a government, and government will give the authority to the particular person for a sale of such a product. Generally if we are not the product that is not written या फिर अगर प्रिस्क्रिप्शन नहीं दिया जाता या फिर ऐसे ही हम अगर कंसीडर करें तो this all drugs they are prohibited in India, but generally the product that is available by the prescription of doctors only. We will see how the dispensing that is going on in how the dispensing and storage that is conducted in a hospital. See, first one, सबसे important, responsibility for a controlled substance. who is the responsible in the hospital? Generally, the administrative head of the hospital, he is responsible for the proper safeguarding and handling of controlled substance within the hospital. Generally, in Indian hospital, if you are considering any administrative head, then we need to consider about the medical superintendent, or we can say the medical superintendent, he is a responsible person, और we can say the dean also. देखिए यहाँ पे इंडिया में जनरली अगर हम कंसीडर करें तो जो भी वेजिटेबल्स या एनिमल्स या फिर मिनरल ओरिजिन प्रोडक्ट है, दैट इज मॉर्फिन या फिर अल्कोलॉइडल प्रोडक्ट सम इज देयर, देन कोकेन, कोका लीव्स, कैनाबिनॉइड्स, these all are we can say that are the controlled substance. And in generally in case of hospital, if you are considering, then generally codeine that is used, then we can say the morphine that is used, and pethidine that is used in a hospital. So these all are the synthetic product, or we can say they are the synthetic organic chemical origin product, or such a product other, that is the heroin also, that is also. Generally what will be the effect? See, why the responsibility that is given to the medical superintendent or dean? Because such a product, they give the depression, sometimes they are giving the stimulation, or there might be the chances of addiction of such a product to the patient. तो इसलिए इसकी जिम्मेदारी या फिर इसकी responsibility of such a product, that is very much important in any hospital. So generally it is given to the medical superintendent or dean. देखिए यहाँ पे अलग अलग हॉस्पिटल के अपने रूल्स वो कर सकते हैं, लेकिन जनरली अगर हम गवर्नमेंट हॉस्पिटल की बात करें तो दिस रिस्पॉन्सिबिलिटी दैट विल बी गिवन टू द मेडिकल सुपरिटेंडेंट और डीन. देन ordering, how this will be ordered, the responsibility for the purchase, storage, accountability and dispensing, that is also on the hand of hospital pharmacist. And also similarly we can say the head nurse of a nursing unit, that is also responsible for the proper storage and use of such a controlled substance, because the controlled product that will be stored in a nursing station also. So in a nursing ward this will also be stored. So that's why this is one of the responsibility of the pharmacist as well as of the nursing staff also. Now we will see about the ordering of wall stock of controlled substance from the pharmacy. तो फार्मेसी में जनरली क्या होता है प्रोसीजर कि डॉक्टर है, दे विल डिसाइड and accordingly the medicine or whatever the control product is there, that will be kept in a ward of nursing station. nursing station में ये रखा जाएगा. So one of the requisition for wall stock controlled substance is completed by placing a check mark opposite the name, strength, form of the controlled substance desired. मतलब जो भी controlled substance यहाँ पे procure करना है, और whatever the controlled substance that is required by the nursing station, that will be asked by the nursing station to the pharmacy store, and one of the form will be sent to pharmacy store. The completed form is sent to the pharmacy along with the empty container and the nurse's inventory sheet. देखिए हम यहाँ पे जो भी फॉर्म है वो देखते हैं. See, this is one of the requisition form for ward stock controlled substance. Over here the name of hospital, ward, code, and what is the date that is mentioned over here. Now number of tablet or capsule what we need to give, then check item, the quantity we need to write over here, then कोडिन कौन सी प्रोडक्ट चाहिए, कोडिन सल्फेट यहाँ पे टेबलेट लिखा है, फिर the strength that has been mentioned over here, and the price that will be mentioned. Generally this is price, this column that is used in a private hospital. Then here the prescribed quantity, कितनी प्रोडक्ट चाहिए वो यहाँ पे लिखना पड़ेगा, and the name of the product and the strength of the product. So this is one of the requisition form that should be filled by the nursing staff and will be sent to the pharmacy. One another request for new controlled substance, देखिए generally any new controlled substance that is issued to the world, at that time the previous supply must be fulfilled. प्रीवियसली जो भी हमने सप्लाई मतलब वहां से ली है तो उसको उनका यूज कहाँ पे किया, दैट वी हैव टू मेंशन. सो ओवर हियर वन ऑफ द डेली कंट्रोल ड्रग एडमिनिस्ट्रेशन फॉर्म, डेली कंट्रोल ड्रग एडमिनिस्ट्रेशन, डेली ये वार्ड जो भी है या फिर नर्सिंग स्टेशन है वहां पे ये मेंटेन करना पड़ेगा. देखिए यहाँ पे अगेन पार्ट 1 एंड पार्ट 2, दिस फॉर्म इज डिवाइडेड इन a 2 portion. So here word, code and date should be written. Then patient name कहाँ पे यूज किया, कौन से पेशेंट को दिया है, specific description of drug, which drug we have used. Then what was the quantity, number of tablet or number of injection, at what strength we have used, 10 mg, 15 mg, that we need to write. Then who has ordered this product, that means we have to write the name of the doctor, administered by the nurses, administration by the nurse, which nurse or the name of the nurse, and the time given, at which time we have given this product to particular patient. So this is part 1. This is daily control drug administration form, and that should be maintained by the nursing staff. Then daily control drug administration form, summary of daily report, part 2. Here again the name of tablet or injection, opening day record, मतलब डेली ये प्रोसीजर करनी है, डेली ये फॉलो करनी है. ओपनिंग डे, आज सुबह क्या था रिकॉर्ड. देन रिसीव्ड बाय whom, व्हाट वाज द टोटल क्वांटिटी, हाउ मच ड्रग हैव बीन यूज्ड, और अभी बैलेंस कितना है. अगर यहाँ पे बैलेंस 0 है, देन आफ्टरवर्ड्स वी आर आस्किंग टू द फार्मेसी, वी आर आस्किंग टू द ड्रग स्टोर फॉर द न्यू सब्सटेंस और द इश्यू ऑफ द न्यू कंट्रोल सब्सटेंस. Then afterward we need to consider the third thing that is important, that is regarding the loss, or we can say the loss of the product. Now whenever there is a drug loss or dose of a drug that is lost or wasted on the ward, so one form we again need to fill, and this is known as a request for replacement of narcotic loss or waste on wards. Generally this is used or this is written by the nurse that is in charge, and we need to write about the incident and why it has been happened, or why there was a loss or waste of the particular controlled drug. Again we need to write about the name of the drug, quantity, container number, record sheet number, then statement what happened, by which way the drug have been lost or the drug have been wasted. Then the signature of the reporting nurse, then head nurse, and then afterwards this should be given to the pharmacy store, and the pharmacist who is receiving this product, they have to make the signature over here. Now this report, this is generally prepared in a duplicate and once sent to the pharmacy along with the nurse account sheet, and a request will be sent for a new supply of the drug, क्योंकि ये लॉस्ट हो गया है तो नई सप्लाई हमें मंगानी पड़ेगी. एंड ओरिजिनल दैट इज फाइल्ड इन द फार्मेसी, एंड वन कॉपी दैट विल बी केप्ट बाय द हेड नर्स, और वी कैन से द नर्सिंग ऑफिसर, ही विल हैव और दे विल हैव वन अनदर कॉपी. तो 2 कॉपी डुप्लीकेट में ये बनाना है. तो दिस इज द प्रोसीजर वी कैन से. और मीनवाइल द ऑर्डरिंग, मतलब वी कैन से कौन कौन सी कंडीशन में ऑर्डर होगा. तो पहली चीज है कि अगेन we need to consider we need one product, so this is one condition. Another condition, new controlled substance, कोई नया controlled substance हमें चाहिए जो हमारे पास वार्ड में नहीं है. और तीसरी कंडीशन कि अगर कोई ड्रग लॉस्ट हो गया है तो in this condition we need to procure it from the pharmacy. So these are the 3 conditions on which we are required the product, or we are ordering this product or ordering the control drug from the ward, from the pharmacy store. Now doctor's order for administration of control drug. Doctor's order for the administration of ward stock of controlled drugs. Prescription must be written on the doctor's control drug order sheet of the patient chart. मतलब एक prescription order रहेगा, prescription order that must be written by the doctor and on a कंट्रोल ड्रग ऑर्डर सीट. कंट्रोल ड्रग ऑर्डर सीट में ये लिखा होना चाहिए. एट दैट टाइम द फॉलोइंग इंफॉर्मेशन मस्ट अपीयर ऑन द डॉक्टर्स कंट्रोल ड्रग ऑर्डर सीट. फर्स्ट थिंग दैट इज इंपॉर्टेंट, दैट इज द डेट, पेशेंट फुल नेम, देन आफ्टरवर्ड्स द पेशेंट हॉस्पिटल नंबर, specific description about this, Then afterwards, the amount to be given and name of the doctor ordering and signature of the nurse administering. So these are the some information that is required when doctor is ordering such a controlled drug for any administration. So over here there might be the situation to the doctor regarding the PRN situation or pro rata or psi opposite, that means SOS order. That means in case of any emergency or when the drug is required in emergency, so there might be this such a condition of control drug, because generally the control drug that is given to the patient in case of severe pain. So if there is a condition like this, then generally the order that is not accepted. But if there is an emergency in that condition, there might be the telephone order and verbal order. If telephone, a doctor may order a controlled drug by telephone in case of very much emergency or necessity. In this condition also, the nursing staff, they will write the order on the doctor's order sheet. मतलब यहाँ पे nursing staff को maintain करना पड़ेगा. She will write that the order that has been given on a phone, and also they will write the doctor's name who have given this telephone order, and also his own initial भी यहाँ पे लिखना पड़ेगा. Then afterwards ये क्या वो टाइम पे वहाँ पे प्रोडक्ट हमने सेंड कर दी, पेशेंट को दे दिया, लेकिन afterwards the control drug, whatever the control drug that is given to the patient, it will be maintained on a paper also. That means we have to do the paperwork also. Then another condition, that is the verbal order, verbally directly to the nursing staff he has given the order. So in such a condition, in extreme emergency where time does not give the permission to write the order, मतलब यहाँ पे इतनी इमरजेंसी है कि भाई समय भी नहीं है या फिर टेलीफोनिकली हम बोल सके ऐसा भी नहीं है, verbally directly if the doctor he has instructed to the nursing staff, then in such condition also the written permission or the written order should be reached to the pharmacist or the nursing station within 24 hours, and it should be signed by the doctor who have prescribed this emergency order. So these are also the method in case of emergency we can do, or the doctor can do like this. Then ordering non-ward stock control drug from pharmacy. See, the drug which are not stocked on the nursing station. देखिए कुछ ड्रग ऐसी है या फिर इमरजेंसी में ली गई है और वो जनरली दैट इज नॉट स्टॉक इन अ नर्सिंग स्टेशन. नर्सिंग स्टेशन में ये प्रोडक्ट नहीं रहेगी, and that might be ordered from the pharmacy on written prescription only. Again the doctor will give one of the prescription to order such a product. मतलब ये directly भी non-ward stock भी हम directly कर सकते हैं. The amount of the drug sent to the nursing unit is the amount covered on the prescription by the doctor's signature. मतलब जो भी product जो भी डॉक्टर ने यहाँ पे रिक्वायरमेंट रखी है, that will be given directly to the nursing unit. The prescription, whatever the prescription that is written by the doctor, that should be given in a written condition and in a ink or indelible pencil. मतलब यहाँ पे जिसको हम इरेज ना कर सके ऐसी कंडीशन में देना पड़ेगा. मतलब यहाँ पे कोई मिस यूज होने का चांसेस नहीं रहना चाहिए. It will not bear any eraser or alteration of any kind. एनी इरेजर का कोई यूज नहीं होना चाहिए ऐसे ऑर्डर में. एंड डॉक्टर मेक नॉट राइट अ प्रिस्क्रिप्शन फॉर कंट्रोल ड्रग फॉर हिज ओवन यूज. देखिए यहाँ पे डॉक्टर पर्सनल यूज के लिए ऐसा प्रिस्क्रिप्शन यूज नहीं कर सकते. मतलब द डॉक्टर दे कैन नॉट राइट फॉर हिज ओवन यूज. देन प्रिस्क्रिप्शन फॉर कंट्रोल ड्रग इन द आउट पेशेंट डिपार्टमेंट. अगेन द डॉक्टर, according to the prescription for narcotic drugs under the Narcotic and Psychotropic Substance Act 1985, must include the following information. First one, patient's full name, patient's address or hospital number, then date, name and strength of the drug prescribed, quantity of the drug to be dispensed, and signature of the physician. Again the frequency, कितनी बार हमें refill करना है ये, and route of administration. This all instruction that should be mentioned to the outpatient department or a the drug that is given, that should be given to the outpatient in that condition. Again here, the prescription must be written in a ink or indelible pencil and shall not bear cross out or any erasers. मतलब यहाँ पे क्रॉस आउट या इरेजर, देखिए ये जनरली इम्पोर्टेंट इसलिए है कि कोई प्रोडक्ट ये एक तो एडिक्शन के लिए यूज हो रहा है, दिस इज अ कंट्रोल प्रोडक्ट, और ऐसी कंडीशन में अगर कुछ भी यहाँ पे इरेजर यूज किया है या फिर वहाँ पे डॉक्टर ने मेंशन किया है 15 mg और यहाँ पे पेशेंट ने आके लिख दिया है 25 mg, तो ये ऐसी प्रोडक्ट है, ये सब का मिसयूज हो सकता है. इसलिए द कंट्रोल्ड और वेरी स्ट्रिक्ट इंफॉर्मेशन दैट इज गिवन एंड the prescription should include this all the things, and that is highly necessary. Dispensing controlled drug for home use when pharmacy is closed. देखिए कुछ कंडीशन ऐसी हो सकती है कि जब फार्मेसी स्टोर क्लोज है, बाहर भी कहीं पे भी फार्मेसी स्टोर में प्रोडक्ट अवेलेबल नहीं है या फिर फार्मेसी स्टोर क्लोज है. सो इन दिस कंडीशन physician, if no physician is available or during hours when the local pharmacies are closed, the following procedure may be followed by only as an emergency measure. देखिए इमरजेंसी मेजर के लिए ये प्रोसीजर फॉलो की जा सकती है. The attending doctor who is attending the patient in such a condition, he will calculate the smallest amount of the drug that is required to treat the patient until the pharmacy open. मतलब देखिए अगर रात के समय में, अगर रात के 2 बजे अगर कोई पेशेंट आ गए है और वो टाइम पे हमें कंट्रोल ड्रग देनी है, so in that condition he will calculate the minimum quantity and that is required for one night. सुबह मॉर्निंग में फिर से फार्मेसी स्टोर ओपन हो जाएगा तो वहां पे फिर से कंट्रोल ड्रग that will be available. So he will write the prescription for this amount and nurse may dispense the medication from her stock supply. मतलब यहाँ पे जो भी नर्सिंग स्टेशन में स्टॉक है वहां से सप्लाई कर सकते हैं. The prescription will be presented to the pharmacy the following morning for the replacement of stock. मतलब अगले दिन सुबह फिर से ये जो भी रिप्लेस किया है तो that will be maintained and that will be given one of the again the requisition will be given to the pharmacy store and the replacement will be maintained, replacement of the stock that will be maintained by the nursing staff, but this will be given only in case of emergency. Then procedure in case of waste or destruction or contamination. देखिए वेस्टिंग का भी चांसेस यहाँ पे रहता है या फिर कंटामिनेशन का चांसेस है. If prepared dose is refused by the patient or cancelled by a doctor, what will be the condition? First condition we can say, if the dose that is refused by the patient ने कुछ refuse कर दिया है dose या फिर patient इस condition में नहीं है कि dose ले सके, or if the dose that is cancelled by a doctor, in this condition the nurse shall expel the solution into the sink and record why the drug was not administered. Drug administered हमने क्यों नहीं किया? For example, discarded or refused by the patient or the order cancelled by the doctor. So this particular information that should be mentioned why there was a wastage of the drug. The chief nurse should countersign this and that will be sent to the pharmacy store. Why the drug that has been discarded or why the drug has been wasted. एक्सीडेंटल डिस्ट्रक्शन और कंटामिनेशन ऑफ ड्रग. देखिए दूसरी कंडीशन ये हो सकती है एक्सीडेंटली अगर देयर इज अ डिस्ट्रक्शन, कोई एम्प्यूल है डायरेक्टली हैज बीन ब्रोकन, और व्हेन अ सॉल्यूशन और एम्प्यूल और टेबलेट इज एक्सीडेंटली डिस्ट्रॉयड और कंटामिनेटेड देन द नर्स शुड इंडिकेट द लॉस. तो ये दूसरी कंडीशन है जब हम अगेन इंडिकेट कर सकते हैं. द थर्ड कंडीशन वी हैव दैट इज द इमेजरेबल पार्ट. देखिए कई बार ऐसा होता है कि वी आर ट्रांसफरिंग द डोज फ्रॉम वन कंटेनर टू अनदर कंटेनर. सो एट दैट टाइम इफ देयर इज immeasurable amount that remain within the container, then in such a condition the drug will be expelled in the sink by the nurse and will not be used again, because in minute quantity this will give or this can give very much effect. So that's why if immeasurable part, immeasurable अगर हमें पता ही नहीं है कि कितनी प्रोडक्ट है, 10 mg है, 5 mg है, so or less than 5 in micron, if there is a microgram quantity of particular product, so it should be expelled, or if it is not measurable, so in this condition the nursing staff they have to report, or there is a certain procedure and it should be countersigned by the chief nurse, and they will explain or they have to write about the wastage or why they have destructed the controlled product. Then control of narcotic on the ward by nurses. So there will be the auditing of the narcotic inventory takes place with each charge of nursing shift. देखिए यहाँ पे जब चार्ज चेंज होगा या फिर नर्सिंग स्टाफ है वो चेंज हो रहे हैं तो एट दैट टाइम देयर विल बी द ऑडिटिंग विल बी डन एंड एट दिस टाइम बोथ द नर्स दे आर कमिंग ऑन द ड्यूटी एंड द नर्स हु इज गोइंग ऑफ द ड्यूटी टेक फिजिकल काउंट, मतलब फिजिकली जो भी क्वांटिटी है ऑफ कंट्रोल सब्सटेंस दैट विल बी काउंटेड बाय द नर्सिंग स्टाफ. And on the nursing station, if the tally is correct, both they will sign the audit record. Audit record यहाँ पे करेगा तो quantity है that is matched. Then in such a condition, the charge will be given to the another nurse. देखिए अगर यहाँ पे incorrect मिल रहा है या फिर कोई proper quantity मिल नहीं रही है, so in that condition again the medication order will be checked. Is there any order that is misplaced or any order that is given by the physician but not written in a stock? So it will be checked, and again if in this condition again if there is an error or is there any loss, then one report must be executed and it should be forwarded to the department of pharmacy or the report should be sent to the pharmacy store. So this is about control of narcotic on the ward by the nurses. The narcotic delivery to the ward. देखिए फार्मेसी स्टोर में से वार्ड में अगर जा रहा है प्रोडक्ट, so again the delivery of the narcotic from the pharmacy to the ward and nursing station may be assigned to any reliable person employed in the hospital. reliable person को ये ड्यूटी देनी चाहिए. देखिए यहाँ पे इसका इलीगली यूज हो सकता है, इलीगल यूज है इसलिए इसका रिलायबल पर्सन के थ्रू ट्रांसफर होना बहुत ही जरूरी है. या फिर हम बोल सकते हैं जनरली वी हैव मेंटेन द स्टॉक, वी आर मेंटेनिंग द क्वांटिटी. तो इन इफ देयर इज एनी थेफ्ट in between the transferring of the product, so it will be come to know to the pharmacy staff or the nursing staff. So if there is any illegal use that is detected, then appropriate measure that should be taken for the recovery of such a product also. So narcotic delivery that should also be considered and very important. Now the routinely used narcotic, we can say codeine phosphate that is used generally as a cough suppressant and also it relieves the pain. Then morphine that is used in case of severe pain or generally it is one of the opioid analgesic in moderate to severe pain that can be used. Then pethidine that is again pain reliever and that is associated with the childbirth or during the anesthetic condition also there will be the pain, so in that condition also pethidine that is used, and pethidine it has sedative effect also. So these are the general routinely used narcotic product which is known as a control drug. I want to show you one website which gives very much important information about the drugs, drug addiction and the classification of the addicted drug. See, these are the drug classification. One of the website is there, addiction center. This is rehabilitation center. They have given information, drug classification based on chemical makeup, that is the alcohol, opioids, benzodiazepine, cannabinoids, barbiturates. Then drug classification based on effect, मतलब drug जो भी कंट्रोल ड्रग है या फिर नार्कोटिक सब्सटेंस है तो व्हाट विल बी द इफेक्ट. वन ऑफ द इफेक्ट दैट इज डिप्रेसेंट एंड स्टिमुलेंट. डिप्रेसेंट इफेक्ट दैट विल बी बाय अल्कोहल, ओपिएट, बार्बिचुरेट. स्टिमुलेंट एड्रियल, कोकेन, मेथ. देन हेल्यूसिनोजन, देन इनहेलेंट. And the drug that is classified based on the legal definition, Schedule 5, Schedule 6, like that, Schedule 3, Schedule 2, Schedule 1. So this website, it gives you very much important information. Some another information I want to show you. See over here, these are the drugs, illicit drugs, opioids, sleeping pills, which product that is used for a sleeping pills, then stimulants, benzodiazepine, drug classification, then drug and alcohol, drug street names, then some another behavioral addiction, that is the gambling addiction, internet addiction, plastic surgery addiction, porn addiction, sex addiction, social media addiction. In US country, there is one report is there regarding the sugar addiction, and generally, which is very much famous nowadays, that is the video games addiction. So they have given some information. You can access this website here, and the treatment that is also given over here regarding that, and rehabilitation center you can find over here with this website. This is for Los Angeles, this website run by the one of the community addiction center, that is of the Los Angeles and LA. Now over here, so we are concluding this video. We discuss about the drug charging policy, dispensing of control, and another one, dispensing of control drug. Here we discuss about the responsibility of controlled substance, ordering word stock, doctor's order, ordering non-word stock, prescribing to outpatient, and the dispensing when pharmacy is closed, and the procedure in case of waste. So we discuss in this about the drug charging policy and dispensing of controlled drugs. Thank you for watching this video.